Canker, treating trichomoniasis in racing pigeons. Canker, also known as trichomoniasis, is a prevalent disease among racing pigeons. Although most pigeons are infested with canker at some point in their lives, mature birds often do not exhibit symptoms. However, stress can trigger severe growth of trichomonads, leading to canker and affecting the overall health of the pigeon. Recognizing the signs of canker is crucial for early intervention. Symptoms may include ruffled feathers, weight loss, loss of appetite, increased water intake, and reluctance to fly. Canker can be easily transmitted among pigeons, especially during transportation when they share water sources. Fortunately, several effective medications are available for treatment, including ronidazole, Cankerix, Trico Plus, 4-in-1 Medpit, and local medicine. Paramyxovirus, protecting young birds with vaccination. Paramyxovirus, also known as PMV1, is a highly contagious viral infection specific to pigeons. This virus spreads through direct or indirect contact with infected birds, contaminated feed, water, or litter. To prevent paramyxovirus in pigeons, it is crucial to vaccinate young birds at 25 to 35 days old, before weaning. The main biological oil adjuvant PMV1 vaccine is effective in preventing paramyxovirus, while the La Sota vaccine, commonly used for Newcastle disease, does not provide protection against PMV1. Strict biosecurity practices, such as maintaining hygiene and limiting contact with wild birds, are additional preventive measures to consider. Respiratory infections, controlling bacterial diseases. Respiratory infections, including mycoplasmosis, catarrh, and ornithosis, are bacterial diseases that affect the upper respiratory tract of pigeons. These infections can lead to various symptoms such as mucus in the throat, open beak, heavy breathing, watery discharge from the eyes, and respiratory problems. Proper loft ventilation, dust and ammonia control, and prevention of overcrowding and dampness play significant roles in preventing and managing respiratory infections. There are medications available for treatment, such as Vetricin Gold, Galamycin, Doxy-Ty, mucus powder, and local medicine. Coccidiosis, protecting the intestinal health of pigeons. Coccidiosis is a highly infectious disease caused by a protozoan that affects the intestines of pigeons. Young pigeons and those exposed to stress are particularly susceptible to this disease. Recognizing the symptoms of coccidiosis is vital for early intervention. Symptoms may include loss of appetite, puffiness, lethargy, watery droppings, and weight loss. Proper sanitation, dry loft conditions, avoiding contact with contaminated water and droppings, and isolating new birds are essential preventive measures. Medications like Sulmit, Belmit, Noxil, 4-in-1 Medpit, and local medicine can be used for treatment. E-Coli, preventing bacterial infections in pigeons. E-Coli, also known as colobacillosis, is a bacterial infection commonly found in pigeons. This infection spreads through infected dust particles, rodent droppings, and contact with infected pigeon droppings. Recognizing the symptoms of E. coli infections is crucial for prompt treatment. Symptoms can vary depending on the affected body part and may include weight loss, loose and mucousy droppings, and respiratory problems. Maintaining good loft hygiene, rodent control, and dust and ammonia control are essential preventive measures against E. coli infections. Medications like Amoxicillin, 4-in-1 Medpit, Furaltadone 20%, and local medicine can be used for treatment. Adenovirus infections, understanding the different types. Adenovirus infections in pigeons can be classified into two types: adenoviruses I, classical adenoviruses, and adenoviruses II, necrotizing hepatitis. Adenoviruses I primarily affects young pigeons and is usually introduced into a loft through contact with infected pigeons or contaminated travel baskets. It damages the intestinal wall, allowing other harmful bacteria to proliferate and enter the bloodstream. Adenoviruses II, on the other hand, is a more severe form of the disease that affects both young and old pigeons. It causes massive liver necrosis, leading to rapid death in affected birds. Understanding the causes, symptoms, and possible prevention and treatment options for these diseases is crucial to combat their impact on pigeon populations. Unfortunately, no efficient treatment or vaccination is currently available for either form of adenoviruses. Preventive measures include maintaining hygiene, proper ventilation, and avoiding overcrowding to minimize the risk of infection. One-eyed colds, identifying and treating eye infections. One-eyed colds in pigeons are commonly associated with physical injuries or pecks to the eye. These infections can often be mistaken for the early stages of mycoplasmosis. The presence of watery or mucousy discharge in one or both eyes is the most common symptom, with severe cases resulting in the complete closure of the infected eye. Proper ventilation, avoiding overcrowding, and minimizing dust levels in the loft are essential preventive measures against one-eyed colds. Local treatments such as Forma drops or Lisicur eye drops can be used to treat the infection. Paratyphoid, salmonellosis, preventing a widespread disease. Paratyphoid, also known as salmonellosis, is a widespread disease caused by a gram-negative bacterium. It can be introduced into a loft through infected pigeons, rodents, contaminated dust, footwear, roaches, or contact with wild pigeons. Recognizing the symptoms of paratyphoid is crucial for timely intervention. Symptoms commonly include rapid weight loss, loose greenish droppings, swelling in the leg joints or feet, wing boils, and respiratory issues. Regular loft cleaning, disinfection, minimizing contact with potential carriers, and maintaining an acidic pH level in the loft are critical preventive measures against paratyphoid. Vaccination and medications like Therapreme, doxycycline, and local treatments are available for treatment. Pigeon pox, understanding and preventing the virus. Pigeon pox is caused by a virus commonly carried by mosquitoes and other biting insects. When a non-resistant pigeon is bitten by an infected insect, the virus enters the bird's bloodstream. Within 5 to 7 days, small whitish wart-like lesions appear on the head, feet, legs, and beak areas. These lesions can grow into large yellowish bumps, but removing them is not advisable as they will eventually dry and fall off. Regular vaccination and controlling mosquito and fly populations around the loft are the best preventive measures against pigeon pox. Vaccines and local medications are available for treatment. Pigeon malaria, controlling a blood-borne protozoan infection. Pigeon malaria is caused by a protozoan that attacks the red blood cells of pigeons. Pigeon flies act as the immediate host and are responsible for transmitting the disease. Symptoms of pigeon malaria are often vague, including loss of gloss in plumage and reduced performance in racing events. Preventing pigeon malaria requires controlling pigeon flies, as they are the primary carriers of the disease. Quarantining newly acquired birds, dusting or dipping birds after contact with others, and avoiding contact with wild pigeons are essential preventive measures. Curing this disease is challenging. Medications such as Austraila water-soluble tablets and Ava's malaria powder, as well as local treatments, can be used for treatment. Sour crop, managing fungal infections in pigeons. Sour crop, also known as candida or thrush, is a common disease caused by a fungal infection in the digestive tract. It is often associated with the excessive use of antibiotics. Symptoms of sour crop include listlessness, loss of appetite, weight loss, a water-filled crop, frequent vomiting, and putrid-smelling vomit. Maintaining proper loft hygiene, avoiding overcrowding, and using antibiotics judiciously can help prevent sour crop. Medications like Digestal, Probios, HealthGuard, and local probiotics can be used for treatment. Worm diseases, identifying and treating common infestations. Various types of worms, including roundworms, hairworms, stomach wall worms, gapeworms, strongylids, and tapeworms, can infest pigeons. Symptoms of worm infestations vary, but they can include droopiness, weight loss, and diarrhea. Gapeworms can cause breathing problems. Regular cleaning and maintaining a sanitary loft are crucial for preventing worm infestations. Implementing a preventative worming program, where all birds are wormed at least twice a year, is advisable. Medications like in and out, moxidectin, ivermectin, and local worming medications can be used for treatment. External parasites, controlling common pigeon pests. Feather lice, red mites, pigeon flies, and mosquitoes are common external parasites that affect pigeons. Feather lice primarily damage feathers, while red mites hide in the loft during the day and feed on the bird's blood at night, potentially spreading diseases. Pigeon flies are dangerous parasites that live on pigeons and can cause discomfort and transmit diseases like pigeon malaria. Mosquitoes are carriers of the pigeon pox virus. Controlling external parasites involves quarantining new birds, using pesticides to dust or dip birds, and maintaining a clean loft environment. Medications like feather lice dust, malathion, tobacco stalks, washout solutions, and local sprays can be used for treatment. Pigeon diarrhea, managing digestive system imbalances. Pigeon diarrhea can occur after medication treatments, causing loose droppings due to a chemical imbalance in the digestive system caused by the loss of friendly bacteria. Medications like Digestal, Probios, HealthGuard, and local probiotics can help restore the balance and treat pigeon diarrhea. Loose droppings, indicators of potential health issues. Loose droppings in pigeons indicate issues within the digestive system and can be caused by various factors, including viruses, adenovirus, circovirus, PMV, or pox, bacteria, Salmonella, E-Coli, worm infestations, over-medication, or excessive racing/training. Normal droppings should be firm, brownish in color with a white tip. Loose droppings can appear mushy, slimy, watery, lime green, dark green, or yellow, each indicating a potential health issue that requires attention. Please note that while this information provides a comprehensive overview of common pigeon diseases and their treatment, it is always recommended to consult a veterinarian for accurate diagnosis and personalized treatment plans for pigeon health issues. There are many reasons to buy my racing pigeon method. Here are some of the best reasons. You will get excellent results. It's a very simple system to use. It's affordable. I have had over 400 first prize winners. It's adaptable to any situation. You can use it with any racing method, natural, widowhood, young birds. It's a very effective method. There is no need to spend a lot of money on fancy pigeon products. It's a reliable system and it is foolproof to use. Professional athletes, race horses, take the same products. There is science behind this, not just hearsay. It is all to do with red blood cells and oxygen in the blood. Without that, a pigeon will not race well, or an athlete will not win a race. If he has low oxygen in his blood, the above is fact and is 100% science. There are a few things you can do to improve your chances of winning at racing pigeons. One of the most important things is to learn as much as you can about the sport. You'll need to know the different types of pigeons, how to train them, and how to race them. Another key factor is practice. You'll need to be able to fly your pigeons competently in order to win races. And, of course, you'll need to have the funds to invest in racing pigeons and other racing equipment.